Hello, I'm Dr. Douglas Drevets. I'm the Chief of Infectious Diseases at the University of Oklahoma Health Sciences Center, and I'm here to give you an update on the COVID-19 situation globally and then also in Oklahoma.
So, where do we stand with the pandemic?
So there's some very interesting trends that have been going on in the last several weeks. And the pandemic has shifted its focus. As you probably know, the case load of new cases in the United States has been dropping steadily now for about 3 to 4 weeks. What's interesting and also very sad is that Brazil is now the world leader in numbers of new cases. And equally interesting that 4 countries to our south, Mexico, Chile, Peru, and Brazil, are in the top 10 in terms of the numbers of new cases worldwide. The other thing that's interesting is that just today, for the first time, a country in Africa, South Africa, is now in the top 10 of numbers of new cases. And the other countries that are in that list include major countries in the Indian subcontinent, including Pakistan and India, and then also Iran. And so the focus of the pandemic has really shifted from originally from China and countries in Asia, such as South Korea, then to Europe and the European Union, then to the United States, and now it is shifting again to Latin America, predominantly in South America, and then the Indian subcontinent, and then presumably Africa will also have its experience with increasing numbers of COVID also.
So is the thought that since it's hitting the lower hemisphere countries more now, it's a seasonal issue? Or?
So there could be some seasonality to this, or there could be many other factors. As you know, countries in the southern hemisphere are now starting into their fall season, which is their traditional influenza season. And this may be the case for countries such as South Africa and those in Latin America and South America also. But since most people are still susceptible to this virus, you know, the worldwide data on serotesting, seroprevalence of antibodies suggests that more than 90%, in some places more than 95% of individuals are still susceptible to the virus. The virus does not have to work very hard to find somebody to infect. It's only in areas such as New York City where the seroprevalence of antibodies is over 10%, and probably some areas in Italy where they were hardest hit. So there's still, most people in the world are still susceptible to the virus, and although seasonality may slow its transmission a bit, it seems that it will still continue to run its course in many places where it has not yet been.
How is it looking right now for the United States as a nation? Where are the hot spots, and are some of the hot spots starting to fade? Or?
Right. So in the United States, we also had a focal epidemic, and the vast majority of our cases initially were driven by those in New York, predominantly New York City and New Jersey. They accounted for somewhere around half of new cases for a time, and still were the lion's share of the cases proportionally in the United States. Their numbers have progressively gone down for several weeks, and what we're seeing is our more focal and slower increases in states including California, Texas, and Florida.
Do you think, since we are in vacation season and people have been cooped up so long, that they're going to start, and I know people are being encouraged to travel by vehicle, so you know, travel within the United States is more likely maybe than international like it would have been. So do you think that might affect some of that?
Sure. You know, in the summer there will be mixing of people from different states and different areas, and that's going to happen. You can still travel, you just have to take precautions to protect yourself. You know, when you're in your own car with people that you've been around all the time, your risk is very low. But when you get out, get food, get gas, and go out and you're around other people, you do need to take precautions, predominantly masking when you're in public, and then also just excellent hand washing.
And so you've talked about internationally, nationally, what is it looking like in Oklahoma?
So in Oklahoma, we've had somewhat of a flattening of our numbers of new cases over the last few days, and the data for today are not out yet. But we've been relatively flat for several weeks in new cases. It continues to go up some days and then down some days. As you know, we had a large outbreak in a meatpacking plant out in Guyman, and then also at a correctional facility, I believe it was around Lawton. And so many of the cases were in those areas. We're also testing about 2 to 3 times as many people as we were several weeks ago. And so it's not unusual that we're going to find new cases. What is encouraging is that our numbers of hospitalizations are not increasing. Those continue to slowly go down, although again, there is some up and down to that.
So what are some precautions that we still need to be taking?
So the precautions are the same as we've been talking about, is realizing that every time you're around somebody else, you may have the virus and somebody else may have the virus even before you feel sick. And so you have to realize that you just don't know where it is. So when you're talking, such as I'm doing now, you're letting particles go out from your mouth. And these are the particles that have virus in them. If you're coughing, there's just a lot more that goes out. Or if you're yelling, such as at a football game, there are just a lot more that go out, and then they travel further. And so you really do need to respect others and protect yourself by wearing a mask when you're around other people. And then just realize that you do have to wash your hands a lot.
Is it, like they've been saying, I mean, I've heard some reports that it is safer to be out, since we can be outdoors. Is outdoors safer, and why?
Right, so I think the better way to look at that, instead of safe and not safe, is low risk and high risk. Outdoor activity is much lower risk than indoor activity. There are relatively few outbreaks that are traced to outdoor venues, although this does happen. And so in those settings, it does depend upon how tightly packed people are together and if they're wearing masks, if they're coughing, yelling, and what they're doing. So think of outdoor activity as a lower risk activity. And then of course you have to think about, is the wind blowing and are you immediately downwind from somebody? Again, if you're playing one-on-one basketball with somebody who is coughing and they're guarding you closely and they're coughing right on you, even though you're outdoors, that is going to be high risk.
So masks still a big thing.
Masks are in vogue, and I just hope this becomes a great fashion trend and that we have, catchy logos that we can put on our masks, because we really need to be in these for a while. And a while is probably until we can get decent vaccine and vaccination coverage.
Is that still looking like 2021 sometime?
Probably so, probably a year out. I know that the government has, I think, half a dozen or more candidate vaccines that they're trying to fund and then put out, and there are, I think, nearly 100 candidate vaccines that are in some form of development or trial. But again, these all have to be tested in people, and they have to be assessed for what's called immunogenicity, which is their ability to elicit an immune response. Then they have to be tested, is this the kind of an immune response that you want? And then they have to be tested for safety. And so it's not going to happen overnight, but we will get there eventually.
So, what are the numbers saying, or the word I'm trying to think of, the models saying about the second wave possibly in the fall?
Right, so modeling is a difficult business, as we've all found out, because the models for the spring were wildly divergent, and the initial models were wildly incorrect. I think it's difficult to assume that what happens in New York City is going to happen in Oklahoma City. I think the best way to think about this is to remember what happened in 2009 with the swine flu epidemic locally. We saw outbreaks, small focal outbreaks, often in day camp or in summer camps throughout the summer of swine flu, and then we had a big spike in numbers of cases in late September, because that's when people got back together for school. I think that's the best experience we have with a respiratory virus such as COVID-19 and what it might do.
So What are some of the, I think some of them are obvious, but what are some of the reasons that states like New York, or cities like New York City and Detroit had really hot pocket areas, and Oklahoma didn't quite see that big surge?
So I think the key factors are population density, just numbers of people in small amounts. Probably a lot had to do with it in terms of commuting practices. In Oklahoma, we really don't have subways that we're on. We don't have large numbers of people using mass transit. And so I think that had a lot to do with it. As you can imagine, if you've ever been on a subway or a metro train, one coughing person in a crowded train could infect 20, 30 people in just a relatively short period of time. We don't have that dynamic here, so I think we avoided that issue. Also, we just have less traffic here. Obviously, there are less people, and there were less people coming in to Oklahoma City through the airport than, say, New York City or Detroit's airport. So that also is an important thing to consider.
So is it safe to travel this summer?
You can travel safely this summer. You just have to be thoughtful about it and realize that when you go out of your car and out and about, you do need to take precautions. Obviously, travel in your own private car is going to be lower risk than going to an airport and getting on an airplane. That said, I think many airplanes, at least those that I've seen pictures of lately, have very few passengers on them, so you can easily socially distance in an airplane if it's only holding 10 people instead of 110 people.
Is it safe to be returning to work?
It all depends on where you work and how the workplace has taken precautions to mitigate the risks. Obviously, if you work in a situation where you're right next to somebody else, then you need to be wearing masks and you need to be have other precautions. There needs to be good airflow in the room. You know, some of the new data suggests that attention to air flows and air exchanges in rooms is actually one of the key things that will help mitigate risk for indoor spread. So your workplace all depends, your risk in the workplace all sort of depends on the things that happen in the workplace.
And safe to return to socializing, restaurants and places like that?
It can be. Again, you have to use a degree of wisdom and common sense with this. Because outdoor activities are lower risk than indoor activities, I think if you can find a place, a restaurant or an establishment that you can sit outside and sit away from some other people, that's the best of all possible worlds. I'm still a little hesitant to go inside restaurants, but I know that many proprietors have taken great care to socially distance people on the inside and do what they can to make the indoor environment lower risk and as low risk as they can. And I just haven't been out exploring those options and opportunities.
Anything you want to add?
Nope.